My name is Liam Lena, and I'm a sophomore gender studies major at Whitman College, and it's my pleasure to introduce our 6th Matthew Shepard lecture. The Matthew Shepard lecture series began in 2005 with funds from an anonymous donor. Matthew Shepard was a student at the University of Wyoming who was brutally murdered in 1998 because he was gay. This lecture series was founded to honor this young man's memory and to create something positive, constructive, and lasting from this atrocious incident. This series brings speakers and public figures to our community to address issues relating to hate crimes and equal rights for all people. Over the last 5 years, speakers have included Judy Shepard, Senator Fink-Wiener, and Keith Boykin, among others. And tonight we are joined by Dr. Kate O'Hanlon, who will be speaking about how civil rights impact health outcomes for the lesbian, gay, bisexual, transgender, intersex, queer, and questioning communities. Dr. O'Hanlon is a gynecologic oncologist who specializes in the multiple applications of the total laparoscopic hysterectomy. She has performed over 1100 total and radical laparoscopic hysterectomies, and she founded the Laparoscopic Institute for Gynecologic Oncology. In 1989, Dr. O'Hanlon wrote and obtained unanimous faculty senate support for domestic partner medical insurance at Albert Einstein College of Medicine in New York, where she taught for 4 years. She then moved to Stanford University, where she initiated and led the Benefit Parity Bill Initiative, which made Stanford the first university in the world to offer an exactly equal benefit package to all employees, regardless of orientation. In 1992, she founded the Lesbian Health Fund, which was established to define, study, and educate lesbians and their healthcare providers about lesbian health issues. The following year, Dr. O'Hanlon was elected president of the Gay and Lesbian Medical Association. She has authored many publications dealing with issues of lesbian health and the impact of homophobia. She published the first evidence of HPV transmission by lesbians and was co-principal investigator of the first NIH grant studying lesbians with breast cancer. She has spoken on LGBTI health issues at the National Institutes for Health, the President's Cancer Panel, the Office of Research on Women's Health, and the American College of Obstetricians and Gynecologists. In 2007, she authored the American College of Obstetricians and Gynecologists District 9 endorsement of marriage equality and published a review of policies about civil marriage equality. Last year, she published the first article about female-to-male transsexuals undergoing hysterectomy. She is a fellow of the Rockway Institute, which is a progressive think tank about LGBTI health and the impact of homophobic discrimination on health. And she gives lectures about the science of gender identity and sexual orientation in universities and medical schools. Please join me in welcoming Dr. Kate O'Hanlon.
Thank you very much, and good evening. It's an honor to be here. It's an honor to be here at such a cool place, I have to say. You guys have gay ducks here. It was kind of new and exciting to read about your gay ducks. And you offer degrees in landscape planning with water features, too, which is very impressive. I've been studying your college. I've driven around all day today and really enjoyed the place. And I understand that this is a representation. I walked right past it. I stole this from your website, this background, which is so beautiful. And apparently it's some glass art that's right across from this building, so I'm going to have to come back someday to see it in the daytime. So what we're going to talk about today is in honor of Matthew Shepard. This was a young man who was crucified on these fences in this area of Wyoming. It was a tragic loss that I think all of us here are working to prevent from ever happening again. As privileged as you are here to be at Whitman College and to be in an academic community where the lay community even supports you to a large extent, we have many brothers and sisters in the hinterlands of the United States, all of whom are lacking their civil rights, but many of whom find coming out a life-threatening adventure. And we hope to improve that. So in talking tonight, we can start by recognizing 4 components of our sexual humanity. There's our orientation, which is the attraction to either men or to women or to both genders, which is on a totally separate spectrum. And remember, a spectrum is not a point here and a point here. Black is 1 point on the scale, and white is 1 point on the scale, say, but the other million points on the scale are some shade of gray. And so with each of these spectra, you can see that nobody exists, or hardly anybody exists at this very point or this very point. Most of us find ourselves along the spectrum somewhere. So our biological sex is our genital anatomy. We can be intersexual, we can have an innie, or we can have an outie. Our gender identity is how we think of ourselves, whether or not we have an innie or an outie. Our gender identity is either, and it doesn't have to be binary. You know, in American culture, we have almost a requirement that people identify as exclusively male or exclusively female, when in fact there's a large number of people in our United States who are born as humans and who find their way in the world, who are born strictly human and who find their way in the world to create a gender identity for themselves that is very real and true, and they don't live at the poles of male or female. And then the fourth spectrum that we recognize is our social sex role, how we do gender ourselves. We can dress kind of masculine, kind of feminine, or we can do androgynous, which is kind of both. So we have in our humanity then 4 different spectra in which we can express ourselves. I'm going to turn this off. And we go. So starting with a little embryology then, up until about the 8th week, we all look quite exactly the same. We have a little tail, and I'll show you our little genitals after we have a brief review of fetal endocrinology. Now, this is not a sexist thing to say, and a lot of times the girls in the audience will clap about this, but it's just a fact that female is the default human. In the absence of any testosterone, or the recognition that testosterone is circulating within the body, Mullerian ducts will make the female innards, and the external articles will stay quite small, because it's the testosterone that tells the outer structures of the genitals to keep growing. There may be a little bit of estrogen secreted, but during the time of, in the first trimester, the brain becomes what we call organized. The neural circuitry is set in the absence of any secretion of testosterone. It is set towards, typically, some varying degree of androphilia and orientation at that time. So that's setting of orientation. And then during that time also, it's thought that that's when gender identity happens. A male will happen if there's testosterone circulating through the blood, but we're going to see that varying levels of testosterone can have varying effects on the fetal brain. And there's possibly another spike at 30 weeks. You know, it's kind of hard to go drawing baby's blood when they're in utero during the first trimester. So we have a lot of evidence that's been pieced together. The brain becomes organized under the influence of testosterone, and that influence stimulates continued growth of the phallus on the outside genitals, and it influences other skeletal changes, and we'll talk about those. So here is a little bitty baby genitals. There's our little tail, there's our little rectum, this is the opening of the bladder and the rectum, and this is our genital tubercle. This is going to be a clitoris, or it's going to be a phallus. Who knows? Because it's 7 weeks, you kind of can't tell. But come 7.5 weeks, you start seeing a little separation between our little rectum and our little bladder opening, and maybe a vagina opening. You see here's the little tail. And what happens is we keep this tail, but the body just grows around it. It becomes your little coccyx bone. So the rest of the body keeps growing. And here you can see the clitoris or phallus. We don't know what it's going to be, but it's still percolating there kind of nicely. Here is another human. At 8 weeks, you can see there's a significant clitoris or phallus there. Rectum is separating away, tailbone's still growing. And you can see some little folds on the side. Don't know if those are going to be a scrotum or if those are going to be the labia majora. You start to see some separation around 9 weeks, however. So there's a little anus, and this is going to be a girl. This is a clitoris sticking out there just as nice as can be. These are the labia majora. And this, in the same magnification, is a penis hanging out there just as nicely as can be. And these are going to fuse in the midline and become a scrotum. This urethral opening is going to migrate all the way down to the tip and then fuse and be open right there. So come around 9 weeks, we start to see some differentiation. At 10 weeks, you can see the little female's clitoris is still quite phallus looking, there's the labial folds there, and here the boy's phallus, this is the same magnification, is looking just as phallus as ever, and he has not fused yet his little scrotal folds. But you can see now any differences in levels of testosterone will cause this to keep growing, and the absence of testosterone will cause this to just kind of stop growing, and this little girl is going to keep getting bigger and bigger while the clitoris is going to stay about the same size. So this is how we're all very similar in the first trimester, but different levels of testosterone, and there are a lot of different testosterones in the body. There are testosterones that are secreted by the adrenals, there's testosterone secreted by the testicles, there's even some testosterones that are secreted by the ovaries. And so we can have varying effects there, which create this status that we now call the interstate sex, or a child born with ambiguous genitals, where the clitoris is kind of medium in size, or the phallus is kind of smallish in size. And here you can see at 11 weeks, this is still quite a clitoris here, but this child is going to keep growing around it, and this is going to be not absorbed. It's going to stay the same size while the little girl grows around it. And here you can see these scrotal folds have fused in the midline, and this guy's starting to look like a real guy here. Okay, so what I want you to appreciate is that there are two processes going on. There's organization, which is the genital and brain anatomy and child behavioral differences that are trained in the brain during the first trimester. Then, later on, the child goes into puberty and starts getting sex hormones, kind of bombarding his little pubertal brain, or her little pubertal brain, and that's when you see activation of these neural circuits that were created during fetal development. So sex differences in behaviors in adults treated with steroids. Like if you gave me testosterone, I wouldn't turn into a boy in low doses. My voice would get a little lower, I might get a little more hair on my face. But unless you gave me high doses, I would not go very masculine. Likewise, if you gave a man estrogens, he may get gynecomastia, but it would take quite high doses, and he would need, transsexuals have the neural circuitry of the gender that they identify with. That's why when you give them the hormones that support their true identity, they feel at home. Okay, so organization then is mostly a permanent effect. Organization happens, say, when you take a mama pig. Now you can do experiments about what organization is. When you give a mother pig testosterone, and then she has a bunch of children, all of her girls will have large genitals, and later on, these girls, when they reach puberty, they'll have more mounting behavior than the control girls not given prenatal exposure to testosterone. And these females will not do what's called the lordotic presentation. When you go, your backbone goes into lordosis, and you present your butt to members of, or people you want to be sexual with, or actually little piggies that you'd like to be sexual with. So these organizational effects are much stronger than the activational effects. You can't change these girls once, these little girl pigs, once their brains have been organized. So organization, we see effects of that on monkeys too. When we check androgen levels during the prenatal and neonatal development, what we see is that monkeys who have been given high levels of testosterone during their development will have play behavior that is higher activity. And anybody who's raised a little boy and a little girl will acknowledge that there are differences in general between boy average play activity and girl average play activity. And I think we have to accept that there are some sexual dimorphisms that are not the rule, but they are in general often true and can give us some guidance. So what are some sexual dimorphisms? Men are taller than women, on average. I mean, I know some tall women, I know some short guys, but if you measure 100 guys and 100 gals, men will be taller. Men have a higher muscle mass. There are exceptions, but they do. What are some sexually dimorphic activities that are separated by gender? Men can throw better than women do. Now, there are lesbians who throw a lot better than some gay guys, and you'll see that testosterone even plays a role in that. In terms of learning skills, these little baby monkeys, they wouldn't stop and ask for directions when they were given high level. You couldn't get them to stop and roll down the window and just say, "Where are we?" Okay. Organization is mostly permanent. So if you take humans now, and you can't experiment with humans, but you can look at human systems and learn from them. If you take and there's this publications, Brian Mustansky talked about normal genetic males, in other words, 46XY males were born with normal testes, but they were removed at birth, and these kids were raised as girls because they either had a injury at circumcision, and we doctors, if we make a mistake, we'll think of a really good Latin name for it so that you think it was a cerebral thing that we did. But if you botch a circumcision, it's not good. And the thinking used to be, if you injure a child's penis, just cut it off and raise them as a girl. It'll be okay. They'll be fine. And that's not true. And also with cloacal exstrophy, that's a congenital opening between, when that opening that's between the bladder and the rectum, I showed you that one single opening, sometimes it doesn't close. And so you have an open area where the bladder is, an open area where the rectum comes out, and when doctors try to fix it without paying attention to whether this little baby was a boy or a girl, they figure, well, it's easier to make her a girl, or make this child a girl. And so they do, but now we know that you've got to actually do a few more tests and find out whether that baby's brain has been gendered as a male or as a female. Because most of them they raised as girls. And when you survey these kids at age 14, what you find is that most have reassigned themselves as men, independently. These children were told wrongly, or were not told wrongly. Their parents were told it's an emergency, you can never tell your children what happened to them, or they'll never be able to accept it, they'll be screwed up for life. Well, it's the lie that screws people up for life. And 80% had women as life partners. And so what we're seeing is that organization of the brain is mostly a permanent phenomenon. If we look at for models in humans, we can see other models. You can't experiment and give a mama, injections of testosterone during her pregnancy to see if you can make her girl daughters a lesbian. But we can observe certain states where the adrenals are dysfunctional that alter a person's level of androgens all during pregnancy. And that's called congenital adrenal hyperplasia. It happens in about 1 in 15,000 births. And what happens is different mutations can cause varying degrees. Who made these slides? Of enzyme inefficiency. So what happens is you have a backup. Now I'm going to show you a slide that you're just going to have to memorize here. This is because we had to in med school. This is the pathway where cholesterol either becomes a kidney hormone called aldosterone or cortisone in the body, or estrogen, or testosterone. And so each one of these little arrows represents activity that an enzyme does. Well, what happens if this C21 little enzyme right here and right here is missing or dysfunctional? What you can see is that these two little doodads will build up and they will drain off this other pathway using this enzyme and this enzyme, and you'll have a fetal buildup of testosterone in the blood. So this is how we can observe what happens when a little boy gets extra testosterone or a little girl gets extra testosterone in the womb, called congenital adrenal hyperplasia. So during pregnancy, there's a couple of types. There's the mild type, which happens, there's low levels of testosterone all during the gestation. And these little girls will come out with mildly increased size of their clitoris. There's the more severe type where the baby is born with life-threatening vomiting and dehydration, and they can have more significant changes in their genitals so that they actually look very much closer to boy genitals. And among both of these groups, you can see more bisexuality, more lesbianism, and more transgender. Even in the non-classical, which is the mildest form when symptoms appear in childhood or adolescence, these individuals still have slightly higher levels and are more likely to become transgender individuals. And here's a picture of the genitals of a baby that is hard to recognize, and you can appreciate this, but this is not an emergency. This is not a reason for the pediatric surgeons to come in and start carving on this so that this baby has a smaller clitoris. When surveyed, adult women with congenital adrenal hyperplasia were very unhappy that their clitoris had been carved down. And when surveyed, adult men who had their phallus carved down or were raised as females were very unhappy. So we now have some guidelines for the management of children born with what we call DSDs, disorders of sexual development. I'm not sure that we should even make it a disease or call it a disorder. It's part of the spectrum between those points on those 4 lines, and we should just create a welcoming environment. Now, with CAH, with congenital adrenal hyperplasia, we see increases in play activity, more aggressive levels in girls. If you talk to the moms of CAH daughters, their little girls had higher activity level, more aggressive play. They said it was more like having a boy child, and they tried to force strong parental encouragement of gender tibia on these little girls, and it just wouldn't happen. You're going to hear more about the medial amygdaloid nucleus because it has androgen receptors, and you'll see that this plays a role in both sexual orientation anatomy and the anatomy of gender identity. Now, there have been research projects where they asked adult homosexuals, how was it for you when you were a kid? And they describe, you know, adult homosexuals say, yeah, I was a tomboy, I was a tomgirl, I always wanted to be a doctor, I was a tomboy. Trans individuals will tell you that they have gender identity confusion that typically starts in adolescence. They may, if they're female to male, they may have negative reaction to their breasts developing or negative reaction to menarche happening. And also there are somatic measurements that happen. You know, in gynecology, we all recognize that there's an android pelvis that some women have, where their bones, their hip bones are just very narrow, and they're more likely to have a C-section because the baby won't fit out. So we know that there are some potential precursors to adult homosexual activity. And we know that CAH increases the likelihood of lesbian orientation. There have only been 17 published reviews, which is a lot, I'm understating here, about congenital adrenal hyperplasia. And if you summarize the results of them, up to 50% will have bisexual or lesbian imagery, up to 20% will have female partners, up to 40% almost will have both, compared to controls. And, you know, in society, about 2 to 4% of women will have a female partner. So here we can see then a gradation. In this article by Mayer Balberg, he's at NYU in the Department of Psychiatry, and he has a cohort of CAH patients. So control women on the Kinsey score will mostly be what we call androphilic. That's the clinical term, because you can't say heterosexual, because when a man's heterosexual, that means he likes women, which is gynophilic. So this is not just a Kinsey score, but this is a score for androphilia. And the score for androphilia is 0 on the Kinsey score. So control women have hover around 0, whereas DES-exposed women, non-classical CAH, simple virilizing, salt wasting, they all have an increasing risk of what's called gynophilia in women. So we have a disease state that explains, at least in that category, how sexual orientation can be influenced. Now, nobody is saying that every lesbian has congenital adrenal hyperplasia or has adrenal insufficiencies or adrenal problems. There are many different hormones in the body that have what we call androgenic moieties, meaning you can have this big chemical, and on one side of it, one little bump has a little androgenic area, and it can budge onto an androgen receptor and push the button of androgen responsiveness. Now, prenatal, there are a lot of other research projects that explain these prenatal androgen effects. You can get a tiny little dose if you're a female who has a male co-twin. The females who gestate all 9 months with a little boy living in the amniotic sac right next door, some of the testosterones from his amniotic fluid will cross over the amniotic sac and get into her amniotic sac because there's some equilibration between the amniotic sacs. And the females who have boy twins had a more masculine pattern of aggression proneness. They had what's called, the bones in their hands were more masculinized. And I'll give you more on that in a minute. They had a reduced risk of disordered eating, which is higher in gay men than it is in heterosexual men, and lower in lesbians than it is in heterosexual women. And they had a masculine pattern of cerebral lateralization, which just means they were more strictly right-handed when they were right-handed. And if you measure their blood levels, they have normal levels of testosterone. So this is something that happened long ago. Did I skip a slide? Let's see. There we go. Okay. So prenatal androgen, if you even go back and look, the Finns kept national registries of children and families because it was a small country and it's what they did. And back in those pre-birth pre-birth control eras in the 18th and 19th century, where all women could do pretty much was grow up and get married, they found a number of females in opposite-sex twins. And these females were 25% less likely to have children than girls who gestated in the womb with another girl. And they were 25% less likely to marry. Now, they didn't have gay back in the 18th and 19th century as far as to the extent that we know and recognize it today. But in that culture, there was not much else a woman could do but get married and have children, since they didn't have birth control and that was the culture. So it's kind of telling us that there's an effect there. Now, here's one of those sexual dimorphisms that we mentioned earlier. Prenatal androgens can have an effect on the bone. So we've talked about the hip bone, but it also happens, there's a change in the hands. This is your 2D, your index finger. And your index finger, oh, I always have to figure out if I'm a lesbian or not from this. I can never tell. Okay. Men have a low 2D, 4D, which means they have a short index finger, they have a short pointy finger, and a longer ring finger. Women, on the other hand, heterosexual women, highly feminized women, have a high 2D, 4D. In other words, their second digit is almost as long or close to their ring finger. Now, don't be checking your orientation by looking at your hand. Not entirely reliable. There are a lot of reasons why I would be kicked out of the lesbian community, and my hand might be one of them. It might offend women if I say I throw like a girl, but that's another reason why I might lose my credentials. Okay, prenatal androgens then. It does also affect the neuronal circuits. Now, we're not going to go through all of this anatomy, but these are published in peer-reviewed journals, and they're areas in the brain, the suprachiasmatic nucleus, anterior commissure, INAH. These are all areas that are different. If you do 100 CAT scans on a man's brain, 100 CAT scans on a woman's brain, you'd find that we Mo's are somewhere in the middle, and that transgender individuals are much closer to the gender with which they identify, suggesting that there is a biologic basis for their thinking that. And we're not going to go into a lot of detail on this, but what they studied was heterosexual men, heterosexual women, homosexual men, homosexual women. Look at the similarities between the Mo men and the heterosexual women. You see how these are more similar than this man and this man. You see how homosexual men have more similarities with heterosexual women's brains, and you see how homosexual women's brains have more similarities with heterosexual men when we're looking at the amygdala. So these are folks whose sexual imagery sites were triggered and they showed their similarities. So there's a lot of biological evidence. Now, we don't have to always have biological evidence for everything. But when we're making state laws, we hold our state accountable to taking care of all citizens. This is not a disability, this sexual orientation or gender identity issue. This is an expression of normal. And the state doesn't allow us to live our healthy, normal lives. Let's keep going. I'll get political later. Okay, neuronal circuits and gender identity. So this is just more sexual, more circuits. and evidence in transsexuals showing that the transsexual individuals are more like their gender identity, their neuronal circuits. Neuronal circuits and orientation, if you do tests and have a lesbian look at a bunch of pictures of female faces, they get a better thalamic heating up than heterosexual women do. Lesbians prefer estrogen pheromones. If you put pheromones, and you can make pheromones in the biology labs and stick them on handkerchiefs and do tests, and lesbians will prefer the handkerchiefs that have the estrogenic pheromones rather than the androgenic pheromones. EEG patterns of gay men are more like women's. So the bottom line is that differentiation manifests itself on a continuum that leads to a variety of patterns of orientation and identity. And then, by extension, preferred partner characteristics. That's the best thinking that we have so far. So there are cognitive abilities that are different as well. You know, gay men and heterosexual women, I mean, you can see this is the job description for being an interior decorator, being a linguist in the military, what else? You know, and I'm playing on some stereotypes, and please don't get offended by that. But these are significant differences that are sexually dimorphic. They reflect differences in the function of the hippocampus, the prefrontal, and the temporal cortices, which are part of the neuronal circuitry that gets organized. Okay, now, orientation and gender and dimorphic skills and behavior. Here's the one where I fail. Homosexual females throw more accurately than heterosexual women. I kind of lose out on that. And homosexual females can hear the lower pitches. And maybe this is evolutionary that we're supposed to hear lower pitches, but men typically hear lower pitch sounds, maybe because they're hunter-gatherers, who knows? Women don't evolutionarily maybe didn't need to hear these little low-pitched sounds or whatever, but you can test to see if you're not sure if somebody's a man or a woman, you can test their hearing. And lesbians might fool you because they hear like a guy. There are better ways to test, but and gay men are more likely to be left-handed than heterosexual men. So these are just differences that tell us that it can't. While we have the ability to make a choice, certainly I could decide that I want to marry a man and live happily ever after. The bottom line is I don't have that urge coming out of my hypothalamus. And so what it means is that there should be some accommodating for people. Now, gender identity, this is one of the men that I have worked with, and he give permission for his picture to be up here. The bottom line is that transgender men, their identity may be set more during the 30-week, there's a little testosterone spike during 30 weeks, at the 30-week phase during pregnancy. And any compounds that might change the level of these hormones, like taking anticonvulsants. More mothers of transgender men took diphenylhydantoin or phenytoin, which are the classic anticonvulsants that we gynecologists have always said we're fine to take during pregnancy. Here's another guy who gives his permission to be on this slide. These guys also may have symptoms for non-classical congenital adrenal hyperplasia, the hyperplasia that presents later in life that's more subtle, that's mild. It may be that these guys just get low doses of hyperandrogenism during their fetal growth, during the entire time, because they have these tests that look more like they have an adrenal problem when they don't. Now let's talk about the issues that relate to male homosexuality. The Y products are in the guy, the boy baby, and he secretes his Y products into the urine. That becomes the amniotic fluid. That chemicals get into the blood, also through the placenta, and mom can get a little bit of an immune reaction to some of his boy proteins. And and you know how each time you get presented with something you're allergic to, you get more allergic, right? So when mom has multiple male pregnancies, she can put out an antibody and either bind the testosterone or block the SRY chemical and prevent the masculinization of the little boy's brain, but not his genitals. And so this is one theory that there are 14 studies giving evidence for, showing that boys with a higher birth order, meaning they're like boy number 3, boy number 4, etc., are much more likely to be homosexual men or male to female transgender gals. So these feminine boys with older brothers also had lower birth weights, like little girls did, compared to boys who had 2 older brothers but were not feminine. Empathy is higher, and I don't want to be, men have to learn empathy, women have to learn how to buck up. But empathy is higher in 4-year-old boys who had lower levels of amniotic testosterone, which happened to be measured during their pregnancy. So we're getting a little bit of research in here. Fraternal birth order and sexual imagery. In research projects done on large numbers of men in New York, the men who said they were heterosexual, but in the survey they said, yeah, sometimes I think about gay sex, whatever. Whatever. Okay. They had a greater mean number of older brothers than did those who reported absolutely no homosexual feelings or imagery. Interesting, huh? And let's see, having absolutely zero androgen in your brain, which nobody has, because even little girls have tiny little bits of androgen in their brain. But if you have no receptor to androgen, then you could have tons of androgen in your blood, say being secreted by a testis, but if you don't have the receptor, which is the mitt that catches the ball, which initiates the sequence of activity that testosterone does, if you don't have that mitt anywhere in your body, this little baby is going to turn out to be a girl. Because remember I said, a baby in the absence of testosterone will grow up as a female and be androphilic. So there's this condition called androgen insensitivity syndrome, where the X-linked, there's a mutation of androgen receptors, and they cannot catch an androgen chemical, recognize it, and send the sequence happening. So these become definitely women. They don't have a uterus. They have a vagina that's about 3/4 of the length long, and they are 100% heterosexual. 100% heterosexual. So now we know what the absence of androgen can look like. So in terms of one of the theories, major theory that we've just been discussing about orientation and identity then has to do with the prenatal androgen experience. Now, it doesn't have to be testosterone, as I mentioned. So if you have an average dose, which is none, if you're a little 46XX little embryo, then you're going to become a heterosexual female. But if you have little traces more than average, and this shouldn't be none, this should be like teeny weeny 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 weeny. Then if you have a trace, then you'll be a tomboy. If you have some, and this is like, these are clinical determinations between trace and some. I'm messing with the theory here. You get what I'm saying though. Because there's one research paper has not been further replicated that says that butch lesbians had higher testosterone levels than femme lesbians, and that the FTMs had very high levels during their prenatal experience. And it may be true about these butch lesbians and the lipstick lesbians, let's just say, because the butch lesbians had more, shall we say, aggressive play as children. Okay, now, if you're a 46XY, and pardon me for stereotyping you and putting the blue in here, but a heterosexual male, that would be like the normal levels of testosterone, like a spike between weeks 8 through 20, and then maybe one at 30. If you had some blocked away, then maybe you would become a gay male. If you had just traces of it, then you would become a male to female, or maybe you have androgen insensitivity. So that's just the theory there. All right, let's keep going now. There's some twinning data that shows, and I'm going to skip to this, the heritability exists among men. There is a gene, and there's a gene sequence that has been identified that accounts for some male homosexuality. These numbers, all above 0.5, suggest that there is a heritability. And here's the X chromosome. This is the Q arm, which is the long one. It's not queer. It just Q means long, as opposed to the P, which somehow means short. I don't know why. Anyhow, here's the little 28 region. You can see it's a flaming red here. And about 33 out of 40 gay brothers will share their XQ28 mutation section, suggesting that some male homosexuality is genetically influenced. And this has been confirmed. 22 brothers discordant for orientation were shown to be also discordant for the gene. And 67% of brothers with same orientation also had the same gene. There is no evidence for postnatal social factors. In other words, a dominant mother, a distant father, beatings as a child. Nothing has been shown to cause homosexuality. Okay, sexual behavior in other vertebrates. Did we invent homosexuality? No, we didn't. No, there are over 450 species of mammals and birds that do repeated homosexual activity in the presence of the opposite sex, forming lifelong relationships, doing all kinds of mutual masturbation, oral sex, just going after it, both genders, all ages, in the presence of the opposite sex. I'm like getting off talking about these animals. It used to be reported as, used to be unreported because the nature observers didn't want to sound like perverts talking about these dirty things. Or they would say, well, it was practiced for real sex. I think they meant R-E-E-L. But the truth is, animals and birds are also homosexual and bisexual. So, is homosexuality a choice or a status? Well, no, because it emerges without experience or exposure. It occurs despite ubiquitous heterosexual indoctrination by our society. It is part of the spectrum of normal. There is no need to change. So say all these radically conservative groups, the American Academy of Pediatrics, American Counseling Association, American Academy of School Administrators, American Psychiatric Association, American Psychological Association, etc. And there's no recruitment. No matter how flaming we act in front of children, no matter how much TV children see about us fighting for our rights as equal citizens in this country, it won't make them more gay. So it is okay for you to be talking to second graders about homosexuality. Now, in our society, though, we have a lot of beliefs that don't apparently need to be based on fact. The percent of Americans believing homosexuality is morally wrong averages over 50%. And the truth is, the biggest difference is not between men and women. It's not in age. It is with Democrats and Republicans. But we can't do too much about that, except vote. But knowing a homosexuality, not knowing a homosexual is the biggest difference, and knowing a homosexual makes you least likely. It makes the biggest difference in whether or not a person is going to think homosexuality is morally wrong. This is why it's our duty to our younger brothers and sisters to be as out as we can be. Take a heterosexual person to lunch and talk to them about what your experience has been. And heterosexual friends who are here, I want you to take your heterosexual friends to lunch and talk to them about your friends and the tough time that they have had. Take a homophobe to lunch and sit there and don't start talking about it until after you've ordered. Because then they'll have to stick around. All right. Now, minority status and mental health is significantly affected by minority status. Perceived discrimination. You don't have to experience discrimination. You just have to know it exists to be injured by it. It's a life stressor because you're afraid you're going to be injured physically, or when you go to the doctor, by their attitude or by their staff. And then the experience of perceived racial discrimination. Our black brothers and sisters have taught us you have more hypertension, more stress, anxiety, depression, lower sense of well-being, lower perceived quality of health. So any kind of minority stress is difficult. And for gay and lesbian youth, it's even more difficult because when a minority person is born, they're born typically to that same minority family. So my little Jewish 2-year-old always knew that they've got their aunts and their uncles and their grandparents who have survived all kinds of anti-Semitic evil discriminations and survived the Holocaust and survived all kinds of a horrible history of tragedy. And my black brothers and sisters have children who know that their ancestors have been horribly mistreated. But they're supported by this history. They're supported by their aunts and uncles and their parents who tell them the story of how we've all risen above it. But when the gay kid is born, there is no uncle or aunt or a parent who says, we've all been through this, it's okay, we're going to love you. The kid is alone, isolated, marginalized, and scared. When I came out, it was still a diagnosis of mental illness. And I had to decide, I think I'm going to go into this mental illness thing. I hope I meet some really nice people. Because I could not shake the fact that I was a lesbian, but I fought it off for years. The expectations, you have a limited future expectations. Gay kids, they don't have models for successful aging unless people come out like they are today. They don't see long-term relationships unless we're obvious. They have restricted perceptions of career options, and they have diminished academic motivation. No wonder. In the 1995 surveys in Vermont, Massachusetts, and Minnesota from the CDC, they found that about up to 4% of boys already had an idea that they were gay, and up to 2% of girls did. And these boys were up to 7 times more likely to not think about suicide, but to attempt it. This is because they're seeing no future. Now, these kids just graduated college about, 4 years ago from that age group. And let's hope that their younger brothers and sisters are seeing a different world. They were 2 times more likely to be beaten up. And if you even look at the questioning youth, kids who are just uncertain of their orientation, they were more than 2.5 times more likely to get beaten up. And when they get beaten up, it's twice as likely to need medical attention. Violence harms your mental health, causing hopelessness, depression, and suicide. And this is in kids from grades 7 through 12. So what are the suicide risk factors then? It's discovering it early in adolescence, and kids are discovering it in grade school today. Boys are coming home with boas, and girls are coming home with catcher's mitts. I want to know about that. The rejection by family members. It's still happening across the United States, where you feel like it is a fall from grace when you have to tell your parents that you're gay. Faith organizations, most of them reject us, and most kids are brought up in some kind of a faith organization. They are wrong. They might as well be fighting and hating redheads, fighting and hating people with facial hair, fighting and hating left-handed people. It's that biological, it's that innocent, it's that innate. And having multiple socially marginalized statuses increases your risk even more. So reparative therapy, we know, is unethical. Psychiatric associations like the American Psychiatric Association has said it's ineffective. It's unethical to treat a normal status as disease, and it harms the individual because you're taking something that cannot be changed. You're subjecting an individual to attempts at therapy, and they're going to fail. And that makes them even more of a failure. Do you see what I'm saying? It harms them even more when you set them up to try to do that. But you need to know it's the experience of discrimination that harms us the most. It's not being gay or lesbian. The Kaiser Foundation survey revealed that among LGBTs across the United States that 3/4 of us have experienced verbal abuse, 3/4 have experienced discrimination, 1/3 have had physical violence, and 39% think about that possibility. But in studies that have stratified whether a gay person has experienced significant discrimination in their life or not, in this survey of 900 men, 17 had suicidal ideation, anxiety, depressed mood, etc. But the only predictor for mental illness among gay men was the experience of social discrimination. The oppression leads to social alienation, low self-esteem, symptoms of psychological distress. And then when you're distressed like that, you do low self-care, you do drugs, you do smoke cigarettes, you do drink more, you do riskier sex. And this is what we need to combat. In the MIDAS study, the midlife development study in the United States, almost 3,000 adults. This was analyzed by Cochrane and Mays. This was a federal research survey, and they never studied their own data enough to analyze it for us gay people. What we found is that 42% had experienced anti-homosexual discrimination, and they were twice as likely to have anxiety, depression, and these stress-related disorders. But 58% among those who said, no, it hasn't been so bad for me, they had exactly normal psychological profiles. exactly normal, saying it's not the orientation, it's the treatment that we get or that we see our colleagues getting in the United States. In terms of, this is the women's health, this is a combination slide from the Women's Health Initiative, lesbian health surveys, and the Nurses' Health Study. And if you can see that lesbians have a higher body mass index, are more likely to be obese, more likely to use alcohol, have a problem history with alcohol, smoke cigarettes, less likely to give birth, and that's because it the reason that's in here is because giving birth lowers your risk of getting ovarian and endometrial cancer, more likely to not have any health insurance, less likely to get a pelvic exam, certainly less likely to use birth control pills, and that reduces your risk, birth control pills reduce your risk of uterine and ovarian cancer as well. That's why that's there. So lesbians have the highest risk factor concentration of anyone for getting heart attacks and multiple cancers. When we go to the doctor, and pardon me for the focus on women's health, but I am a gynecologic surgeon, and so I know a little bit more about lesbians' health. In surveys that were reported in the Journal of Fertility and Sterility or the American Journal of Obstetrics and Gynecology, no one refused married couples embryo transfer or assisted reproductive technology. 55% would accept lesbians for embryo transfer, 75% would accept lesbians for assisted reproductive technology. They're refusing to inseminate us, refusing to help us to have our families. And that's discrimination within my field, which we're trying to combat. And for no good reason, because every research project, and these have been summarized by the American Academy of Pediatrics, showing that 1/3 of us lesbians and 1/5 of gay males have children that they're raising under the age of 18. These children are not different in their sexual identity or gender role variance, as if that might be a problem. They have no more adjustment difficulties, no behavior problems. They're not more likely to be gay or lesbian. There's no increase in molestation. And in fact, if you do a sub-analysis, you'll find that there's no difference in their mental and emotional health. Boys might be slightly more affectionate, nurturing, sexually restrained. I'm not seeing a problem here. Girls might be a slightly more, where's the girls? Girls, more androgynous, slightly sexually adventurous. Not seeing such a problem here. They may experiment with orientation, but then they come home to whoever they are. The co-mothers were seen as good parents. They spend more time, and they were more nurturing than husbands were in this study by Stacy and Bibblers, published in the American Sociological Review. Okay, so I'm going to wrap this up a little bit here. If you can't get married, your children can't receive Social Security support if your working spouse dies. If you can't get married, separation or custody issues then go to a civil contract court. They don't go to family court, which rules for the best interest of the children. You can't file a joint tax return. You can't marry a spouse from another country. You can't receive, the couple will receive Social Security as two single people, which is less. You cannot bring the dead body of your beloved spouse home from most states in this country. You've got to call their brother or sister to get permission. And when the earner dies, the surviving spouse can't receive Social Security support, and the estate gets taxed at 55%. In other words, if you take half of your half, 25% of your estate will go to the government. That doesn't happen in heterosexual families. Marriage benefits health. Marriage confers stability for the children. Children need an identity. They need to feel like their family is equal to every other family in the grade school. It's destabilizing for children to hear, my mommies can't get married. But they're partners and they love each other. They get defensive. Marriage also promotes health in the partner. Reduced rates of cardiac disease and cancer, and there's greater longevity among married partners. So what do you want for your family? You'd like to age through a happy life. You'd like safety. You'd like quality education for your children that reflects your family. You'd like job security. Maybe you want to serve your country. Maybe you'd like to marry your loved one. Maybe you'd like to have financial security for the rest of your life. This is the gay agenda. Be afraid. Now, how many of you have heard of Maslow's hierarchy for needs fulfillment? This is like, you know, we humans, we have to secure issues of food and water and safety, and then we can deal with issues of shelter and warmth, money. Job ultimately turns to career, and community building and comfort. And the highest thing that we do is to create family, to have intimacy with another person. But we gay people are thwarted at every level of Maslow's hierarchy by physical and verbal violence, by permitted job discrimination and housing discrimination, organizations of faith. Our family can teach us wrong, and schools allow for disdain, and the marriage and adoption laws in this country get in our way. And yet we're tax-paying, good, healthy, biologically sane people. It's homophobia that's the health hazard. Being gay or lesbian is not dangerous. Being transgender is not dangerous. There are risk factors from homophobic fallout. It's the process of homophobia, of teaching every new generation of children to hate themselves, or to hate the gay kid, or to be afraid of difference. It's the process of teaching, conditioning of gay and lesbian kids against themselves. That is the potent health hazard that we need to fix. If we look in the rural South, we used to be able to see 2 water fountains, and they looked exactly equal, but when you just named them for whites and for colored, you've created discrimination, even though it's the same water and the same clean sink. When you take humans, there is no separate but equal. When you take relationships and you call one domestic partner and you call the other marriage, you are still discriminating. You are still creating an underclass. There's no two ways about it. It enforces a subclass in America. In 2009, we were behind Sweden, the Netherlands, Belgium, Spain, and we've called ourselves the land of the free and the home of the brave. Yet 44 states prohibit marriage. 44 states have come out against us. We have a Bill of Rights. We are not following it yet. That says that all humans are created equal and that we're entitled to the pursuit of happiness. Now, I'm going to talk about black history a little bit, only to say there is no analogy between the mistreatment and the taking of 44 million black lives. There is no analogy in gay history for that. But we learn from our African American brothers and sisters healing, because with every blow dealt our black American brothers and sisters saying separate but equal can exist, or that there were slavery laws in every state, there was a healing. Military was integrated. The Supreme Court said race discrimination is illegal. Congress said no discrimination, and the Supreme Court said that there's marriage equality. If we look at female Americans' human rights, there were forced marriages, there used to be. Companionate marriage gradually evolved. Women finally got the vote. Military segregation used to be legal, not anymore. Congress finally came around, the Supreme Court came around, and Congress has said that there is marriage equality. It's not legal to rape your wife. Gays and lesbians have a similar history. State laws said homosexuality was illegal. Military, we were expelled. We started revolting. The Supreme Court said there is no right to private adult consensual sex in the Bowers versus Hardwick. Finally, they came around in 2000 and said we can have privacy in our bedroom. Thank you so much. Now 6 Supreme Courts have said that we can have marriage equality, but the military is not integrated. Congress has not said that there can be no discrimination, and the Supreme Court has not legislated for us. We're waiting for this country that we love, that we pay taxes to, more taxes than our heterosexual brothers and sisters, to come around and treat us like the humanity that we are. Because traditions are important to us too, you know. We were not recognized in this Bible writing thing that happened in about 400 AD. Women weren't recognized, people with diseases were discriminated against, there were slaves, it was okay. So we can't exactly use the Bible to make our laws. Marriage is very sacred to a lot of gay people and very meaningful. It's our tradition too. We come from traditional families, and traditional families are not demeaned by our presence. Homosexuality is immutable. It's like having red hair, but it is not contagious like having red hair. So there's no bad example. People are always worried that they're endorsing homosexuality. Well, you know what? It's like endorsing red hair. There's nothing to it. There are no gay rights, by the way. There is no gay marriage. There's just human rights, and we're still waiting for ours. So if science shows that there's no immoral proclivity, If there's no mental pathology associated with homosexuality, if all the mental health organizations in the United States have endorsed marriage for us, and they have, then there should be no basis in our laws for anti-homosexual legislation. Our science should be reflected. The American Academy of Child and Adolescent Psychiatry and American Academy of Pediatrics have endorsed adoption, and all these organizations have endorsed marriage. The bottom line is we have to start by educating parents and children. You have to go give this talk in your families, give this talk to your most homophobic friends. Talk about school, societal, familial attitudes that affirm the dignity and rights of LGBTIQ people. And that's been endorsed by all these radical left-wing organizations like the American Association of School Administrators, American Psychological Association, etc. Because equal rights are what we need for good health. Equal rights are human rights, and I want you all, since you're here, to please be a part of the solution. Thank you very much.